We get a lot of OR time, which as an intern I feel like isn't overly common, and it's actually a lot of OR time where it's just you. So as an intern, you're the only resident in the room. So sometimes interns get to go to the room, but they're third scrub, fourth scrub, and they're just kind of watching. And our attendings actually let us be hands-on. They're monitoring us, but they're also kind of assisting and pushing our boundaries so that each day you get a little bit better.
I'm getting more hands-on training than I think generally would be expected of somebody my year level. It's definitely a highlight of the program, a perk of the program is being able to have so many attendings per resident. We have a pretty good ratio, and that allows us to get in the operating room early and start developing some of those technical skills.
So we have a very robust general surgery rotation, also with trauma. We are the region's only trauma center. Currently, we are a level 2 with plans in the next 2 years to implement a level 1 certification for the state. With being an area that is as large as we are, 700 plus bed hospital, we serve the needs of all the rural counties around for 100 miles. We serve people that otherwise wouldn't be able to get care that they need.
But I think typically we'd get here about 5:30 in the morning, do our pre-rounding, see all the patients on the floor on service, and then after that, generally we go to the operating room or clinic, depending on what your tasks were for the day. It's usually busy and steady and fills the day up.
One really nice thing about this program is we actually get what's called a study hall. So they give us 1 day a week where we have about 2 hours. We get to leave at 3 o'clock, and so from 3 to 5 is our study hall hours. So we'll take quizzes every other week, and then you can review quizzes, you can study, and so it's just kind of a nice time slot for a very controlled studying. And then from there, I just like to try to study kind of throughout the day if there's gaps, because a lot of times there's OR turnover time, or in clinics between patients there's lunch breaks, and so I just kind of scatter it in.
We're not too big, so I know everybody's name, and I think all the faculty do, but we're not too small where patients don't have to go to another facility to get treatment.
I feel like we have a very different community from kind of the standard general surgery idea, like the picture that's in the TV shows and the movies of kind of like that malignant culture. We definitely don't have that. There's just really not anyone in this program where if I found myself in a pinch and I needed help that I don't feel like I could go to and ask help for. So
it takes a certain resident to be interested in this facility, but I think it has everything you need to be a confident and competent surgeon whenever you complete.